Joint infections following surgery are complex and very, very difficult to manage in one way.
There are a number of different surgical options, ranging from debridement of the infected tissue at an operation that's called DAIR, debridement and implant retention. So we operate but we leave the implants inside, through to operations where we take all of the implants out and replace them. The DAIR is the smaller of the operations, but it is still a big operation. It's really important that the wound is actually debrided and not just washed out. The bacteria will adhere to the tissue, and so it's important to physically remove all the infected tissue and then wash the residual tissue out. If you just wash out the infected tissue, you will not manage to clear all the bacteria.
That's when they took, because they took great pleasure in telling me, it was 1.5 pounds of infected flesh out of my hip that was like rotten.
With the debridement option, we know that the earlier it is done, the more effective it is. We don't know exactly what the cutoff is, but we know that if it's done early, it has up to 80% chance of clearing the infection, particularly in joints like the hip. But as time goes on, that can drop off.
I was in hospital for 5 weeks and then sent back home, obviously on antibiotics and everything. Unfortunately, within 3 weeks, I had another massive infection, and then taken to Southmead this time. Had another debridement, and they also replaced part of the hip. They weren't clearing the initial infection, so it would go dormant, if that makes sense, with the antibiotics, because obviously when I was in hospital I was on IV antibiotics, quite strong, and so it would seem to sort of like clear it, but it was dormant underneath. And then when I got home and I was on oral antibiotics, which aren't as strong, it would flare back up again.
When the infection becomes more established, debridement becomes less effective. And at that stage, the surgical team may offer you a revision instead of a debridement.